The niacin flush is one of the most unmistakable and uncomfortable side effects in the world of supplements. Warmth spreading across your face, prickling skin, a sudden red flush, and the uncanny sense that you've just been slapped by your own vitamins. For some, it's a mild annoyance. For others, it's a deal breaker. But what few realize is that this harmless-seeming reaction is more than just a quirky side effect. In fact, it may be the body's first alarm bell, signaling that something deeper, something more toxic, is brewing underneath. Niacin, or vitamin B3, is essential in small amounts for energy metabolism, DNA repair, and nervous system function. But in the world of cholesterol management, it's used at very high pharmacological doses, sometimes up to 2,000 to 3,000 milligrams per day. At these levels, niacin isn't acting like a nutrient, it's acting like a drug. And as with most drugs, the benefits don't arrive quietly, and neither do the side effects. The flush is driven by prostaglandin D2 release, a chemical that dilates small blood vessels, particularly in the skin. It's a rapid reaction, often within 30 to 60 minutes of taking a dose, and though it fades, it sends a message. This dose is being noticed, system-wide. It's a biological flare gun. And while the supplement industry has gone out of its way to develop flush-free versions, it might have been wiser to pay attention to the flush as a warning, not a nuisance.
Why?
Because long before any cardiovascular benefit from niacin appears, if it appears at all, the liver is already working overtime. High-dose niacin has been consistently associated with elevations in liver enzymes like ALT and AST, classic markers of hepatocellular stress. In some cases, these elevations are mild and transient, but in others, they signal more serious injury, fatty liver, fibrosis, or even hepatic necrosis, especially with sustained use. The liver's role here is not just to metabolize niacin, but to detoxify its byproducts, including nicotinamide and methylated derivatives like N-methylnicotinamide, MNA, which are then further broken down into compounds such as 4-PY. These metabolites, when accumulated in excess, have been linked to oxidative stress, mitochondrial dysfunction, and vascular inflammation, none of which sound particularly heart-healthy. Ironically, the very pathways that niacin was supposed to protect, lipid metabolism and endothelial integrity, are now under biochemical siege, all because the dose was too high, too long, and too often. Some patients report nausea, vomiting, or abdominal pain before they even make it to the lipid improvements. These are not vague discomforts. They can be early signs of liver irritation, especially when coupled with fatigue, dark urine, or yellowing of the eyes or skin. And yet, these warnings are often dismissed or misinterpreted as adjustment symptoms, while the daily megadoses continue. The metabolic complications extend beyond the liver. High-dose niacin can impair insulin sensitivity, leading to blood sugar spikes, especially in people with prediabetes or type 2 diabetes. It can also increase uric acid levels, which may trigger gout attacks in susceptible individuals. So now, in addition to flushing, you might be dealing with unstable glucose levels, painful joints, and an overworked liver, all in pursuit of a modest HDL bump. And about that HDL, niacin does reliably raise it, but this has not translated into reduced cardiovascular events in multiple large trials. The AIM-high and HBS2 Thrive studies both found that while niacin improved lab numbers, it did not reduce heart attacks or strokes, and in some cases, it increased the risk of serious adverse events, including infections, bleeding, and yes, stroke. So the supposed benefit may be more of a biomarker mirage than a clinical reality. Flush-free formulations, often made from inositol hexanocotinate, avoid the burning face, but bring their own problems. These versions are less effective for cholesterol, but they still carry a hepatic burden, and because they lack the immediate feedback of a flush, users are more likely to take high doses blindly, silencing the warning system while the damage unfolds invisibly. In the end, the niacin flush is a useful friend, not a foe. It tells you, in no uncertain terms, that you've crossed into pharmacological territory and that your body is mounting a response. Ignore it, and you may face consequences that are far more serious than a red face. Niacin remains an important nutrient and a valuable therapy in rare cases. But the modern practice of using it casually, excessively, or chronically, often in people who don't even have severe dyslipidemia, is a textbook case of good intentions gone rogue. It's not just about too much of a good thing. It's about how a nutrient, taken out of its natural context and supercharged into drug-like doses, can backfire and do so long before it delivers any of the promised protection. So, if your face burns after niacin, consider it a signal, not just to take an aspirin and move on, but to ask a bigger question. Is this dose doing more harm than good? And perhaps, just perhaps, the safest path to heart health doesn't lie in milligrams, but in moderation.